Alongside our famous individualism, there's another ingredient in the American saga, a belief that we're all connected as one people. If there is a child on the south side of Chicago who can't read, that matters to me even if it's not my child. If there's a senior citizen somewhere who can't pay for their prescription drugs and having to choose between medicine and the rent, that makes my life poorer even if it's not my grandparent. It is that fundamental belief, I am my brother's keeper, I am my sister's keeper, that makes this country work. E pluribus unum, out of many, one.
I chose this program for a few reasons. One of the biggest attractions was that it's unopposed and it's a community hospital, but also in a very large healthcare system. So there's resources, but also the intimacy of your education. In addition to that, the people I work with are incredibly down to earth, incredibly smart, and the attendings and physicians, they love to teach.
Why I chose this program is because I am a minority and I definitely wanted to serve the underserved population.
The giving back to the community.
The supportive faculty.
I felt very at home.
You know, we're kind of like a really big family and we all get along really well.
The opportunity to work with different kinds of patients from different backgrounds.
The city of Chicago, everyone loves it here.
The feel from the other residents and faculty.
We know closely with the underserved communities.
The program also has a really strong OB curriculum.
All the help that you get from your co-residents as well as faculty, and it just makes life so much easier, especially residency life that can be so stressful.
The plan that they have with community medicine.
There are tons of support.
It was a great moment of pride for me to be able to serve the community that essentially served me and helped me grow up into the physician that I am today.
The opportunities are limitless.
We truly have a full scope family medicine residency program, which gives you a great experience doing obstetrics, the family medicine and patient service, as well as the ambulatory piece. We are also very much invested in serving a large underserved population in the southwest part of the city and practice patient-centered, evidence-based medicine. So we are looking for applicants who are also interested in our mission of caring for underserved, vulnerable populations, and are looking for residents or applicants that are also willing to continue. So I encourage you to check us out, come and interview with us, and see what we're all about.
I think ever since I was choosing a residency program, I knew that I could not work in a place that refused people care because they didn't have insurance. But I went to a place that also was a community health center housed within a hospital, but a community hospital this time instead of a university hospital. So we don't turn people away because they don't have the ability to pay. And the hospital is, I believe, the largest safety net hospital in the state. So I've been able to continue to provide that kind of care to patients in need in a really interesting, dynamic community, and in a setting in a community hospital where you get to know everybody, and where family medicine remains the only residency program sponsored by the hospital, and where family medicine is valued by the administration. The outpatient side is patients in need, but it's also incredibly diverse, which is one of the things I appreciate about it. So I take care of elderly patients who don't speak English. I take care of architects and professional people, and I take care of generations of families. Inpatient, we take care of our own patients from our growing community health center network. We also take unassigned, uninsured patients who come into the emergency room, up to a cap. It provides seamless care from the inpatient side to the outpatient side for our patients when they're discharged. It also allows us to continue to provide service to communities that really need our help. One of the unique aspects of the community health center prime care that we work in is that it is entirely a family practice model, family medicine model. Everybody who works in the community health center is a family physician. Our teaching service, our adult medicine teaching service, is staffed entirely by our faculty. both those faculty who are employed as full-time faculty as well as the clinical faculty who are employed by the community health center. And it's a different model of care. We bring a perspective to care that integrates what we know about the patient and their family from the clinic. We know these patients. We know their families. And that provides a perspective that I think really provides great care for our patients.
So I have two main passions at work. The first one is social justice, to make sure that my patients understand that healthcare is a human right and that they have access to the best health care they can get. My second passion is medical education, and I just have loved it from the beginning. I started medical school just in problem-based learning curriculum, and it was so exciting to try and figure out that this might be the way that we teach doctors how to think critically. I came back and got a fellowship in faculty development and went on to get a master's in medical education that included curriculum development, leadership abilities, how to work in academic places, as well as a research project. I went on to work at Northwestern Medical School and the University of Chicago Medical School to develop curriculum and teach students about the general clinical skills that they need, but also the importance of understanding cultural competence, disparities of health, preventative health, and how we take care of vulnerable patients. I've come to the residency so excited to be doing this sort of medical education here. I work with the faculty on faculty development. I work with the residents to be teachers of the future. I'm developing curriculum throughout the residency, specifically now on LGBT topics, more cultural competencies, and to figure out how we can make the physicians the best doctors they can be.
I'm a family doctor, and I am the medical director of Prime Care Wicker Park Family Health Center. My pitch to those folks who are considering coming to the St. Mary and Elizabeth Family Medicine Residency Program is around advocacy and serving folks who are marginalized or underserved in bigger picture ways than just in the clinic. My particular passions are around global health and advocacy for immigrants, and in particular at this point in time around folks who are asylum seekers. So I've been quite involved locally and even in some projects across the country in working with new immigrants who are arriving to the United States, and in particular in Chicago. That really inspires me. My whole perspective to you is that there are plenty of opportunities within the residency program and by working with Prime Care, the community health center, to get involved and to even become a leader in serving immigrants and in serving folks who are very marginalized. I've been involved quite a bit with global health projects throughout Latin America and Africa, and even actually in rural outback Australia. This, I found, helps me be a better family physician, not only when I'm sitting in front of the patient to have some context about their culture, some context about their life, but also helps me then be a better advocate. The one thing I would say as being a family doctor is that you never are just a family doctor. You're never just the person who's sitting in the room. All of us, no matter what setting we practice in, are involved to some extent with things going outside of our practice, outside of our clinic. Being involved around bigger picture issues with immigration, that's sort of what we're called to do as family doctors.
We have faculty who are committed to providing women's health care to underserved patients on the west side of Chicago, and our residents get to perform and assist in a number of gynecologic procedures. We have docs who are committed to providing excellent obstetric and women's health care for our patient population on the west side of Chicago. As a fellowship-trained FPOB doc, I feel like the residents get a great experience here. They're working closely in conjunction with our family medicine faculty as well as the OB physicians to provide great care for our patients. We have a great working relationship with the nurses on OB and with our OB consultants. We work really well as a team, and it is a great work environment to deliver babies in. We provide excellent training in a number of gynecologic procedures at our office. We have an innovative colposcopy track for residents who plan to provide women's health to underserved patients in the future.
I am Lisa Milan Flanagan, and I am the Associate Program Director of the Residency program and also responsible for the OB curriculum. The curriculum that we have here is a very well designed and teaches you to be comfortable providing the preconception care, the care of the pregnant patient at very early stages, and we guide you to do prenatal care and provide all the preventative services. Once the patient complete the prenatal care and they get to the labor and delivery, it's your patient and we help you to provide the patient-centered delivery. It is a great experience that after you know and follow that patient at the end of pregnancy, after the delivery you start taking care of the babies.
So I would like to talk a little bit about wellness because I think residents are always interested in wellness. So the National Wellness Institute defines wellness as the conscious, self-directed, and evolving realization of one's own full potential. So I think that here at St. Mary Elizabeth, our residency program does a really good job of providing the kind of support and organization that residents need to achieve their full potential. Operationally, we have a night float, which is very nice. None of our residents ever take 24-hour call. We have a really great group of accessible and engaged attendings. I think that the residents themselves are very bonded to one another and they do social things together. We do have a Wednesday noon yoga, the opportunity to just connect more deeply. I have been working in underserved medicine for more than 20 years, which I love. And one of the things that is deeply satisfying to me is the ability to make a difference in the life of somebody whose life may have been very difficult.
So one of the things that I love about family medicine is that it's the only residency program that is obligated to have a behavioral health faculty and embedded as part of the faculty team. And this, the reason for this is because a lot of what family physicians do is work with people who struggle with emotional health. One of the things that also has been very powerful for me is that there are behavioral health professionals embedded with the practice of the family physician. So for instance, in the FQHC in Prime Care here, we have behavioral health providers sitting at the preceptor room together with the residents, together with the MAs, and together with the preceptor. So all the residents that come and talk about the cases that they're trying to work through can be heard by the behavioral health, and the behavioral health can chime in. This creates a true integrated system of care.
Currently, I'm also helping develop an LGBT health curriculum, and I use also one of my interests involve women's health as well as Latinx health. We serve also other minorities, and being able to serve those two communities and actually help develop the curriculum to care for those communities has been very meaningful to me.
I'm in charge of the community medicine portion of our residency program, which means that I send residents out into the community. Obviously health doesn't start when you go to the doctor's office. Health starts outside of the clinic. And so if you understand a person's economic status or education level or what's going on in their community, do they have access to food? Is there a lot of violence, or is it a safe community? Then you have a better understanding of where your patients are coming from.
Being a third-generation family medicine physician, I've been fortunate enough to work with a patient population that's very dear and near to my heart, those afflicted with addiction. In our medication-assisted treatment program, we treat people with a mix of opioid antagonists and agonists, such as Suboxone. We work as a team to help care for the patient. We work with our care coordinator, our social worker. We're able to help assist patients to become more stable in finding housing, finances, employment, education. It's just really, really amazing.
I think I've been working with Prime Care for almost 30 years. So many of my patients I've known for many, many years. I always sort of envisioned family practice as the kind of career where you would get to know people and sort of become a part of their lives, and that has certainly been my experience working at Prime Care. It's a nice experience working in the community with people who are a part of the community. We were just fortunate, I think, to be able to get a group of people together who really had a vision that had come from a lot of different places for providing care in a caring, compassionate way to people who needed that care. And I think that's sort of where Prime Care grew from, and we've just been fortunate to be able to recruit providers, staff who share that vision.